I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and I was just asked this question: are testosterone pellets safe, or do they increase the risk for breast cancer? For those of you who don't know, sometimes testosterone pellets are used as a form of hormone replacement therapy or to replace hormones for people who are going through perimenopause or menopause. The answer is we don't really know. There isn't a lot of data on testosterone pellets and whether or not they impact breast cancer risk compared to other forms of hormone replacement therapy. The American College of Obstetrics and Gynecology doesn't recommend testosterone pellets because of the lack of data. So, aside from not knowing about the future breast cancer risk with testosterone pellets specifically, the other problem that I run into as a cancer surgeon is sometimes a patient will have an estrogen receptor positive cancer like this one you see on the screen. And if they've just had the testosterone pellet replaced, then we can't really remove it, we just have to wait for it to dissolve on its own. Which means a cancer like this would still be fed by estrogen, which is one of the byproducts of testosterone as it's being broken down. And that estrogen feeding this cancer could cause it to grow and spread through the lymph nodes and other parts of the body. Meanwhile, if a patient is taking a pill or using a transdermal patch, then we can stop all of those and reduce the levels of estrogen in the blood pretty quickly, so that way that estrogen doesn't continue to feed a cancer which we know responds to estrogen. So my recommendation for anyone who's considering testosterone pellets is to make sure you go to a board-certified OBGYN and talk to them about the risks and benefits. And so for everyone who is considering hormone replacement therapy, I think it's important to have a conversation either with your OBGYN, your PCP, or with a high-risk breast clinic about your risk profile and about how it may potentially increase your risk and what you may want to do to be monitored more closely if you are someone who's already high risk for breast cancer.